Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute's Facebook page. We invite you to submit any questions or suggested topics you have to any of our social media linked in the description, and the stories today will be up through November 7th. Starting with our abbreviated COVID statistic, we only have average COVID deaths, but in the last recorded week, average COVID deaths per day were 76, and in comparison with 2023, the same week, we saw 198. Your reaction to those numbers, Dr. Murphy?
Yeah, they're drifting downward. This is the end of the summer bump. So this is going down just before we get to the winter increase in respiratory infections, which is going to start in December. So the nice thing about what's going on here, the good thing, is that it's way down from 2023. So this is due to basically the immunity that everybody's picked up, either from having COVID or having a vaccine or having both. And to remind people, the data is quite clear. The people with the best immunity had COVID and the vaccine. They did the best. Then the vaccine people, and then finally the people that just had COVID. So the immunity is different between people. If you're anywhere at risk, I mean, this vaccine is approved for people 6 months of age and older. So, you should stay up to date. The vaccine that was distributed, COVID vaccine in September, is the one that's really deals the best with what's circulating right now.
Mm-hmm. And on the note of those declining COVID numbers, for a while, COVID was the largest infectious disease killer on the globe. But as those numbers have gone down, a different ailment has gone back up to that number one. Can you tell us what it is and the status?
Yeah, so what we are referring to is tuberculosis. It's really increasing. So when COVID basically took over the world, flu cases went to almost zero because COVID outcompeted everything. Tuberculosis went down too, probably because of all the mitigations that were put in place for COVID. But anyway, this year, so far in 2024, data released last week shows that 8.2 million people were diagnosed with TB. That's probably an underestimate. They do modeling. It shows it was probably 10.8 million. So this is up a little bit from 2022. But that's an awful lot of cases. So how does that translate to in the number of deaths? Now remember, TB is preventable. It's treatable. There's no real vaccine for it or anything, but it can be dealt with. But it's the leading infectious disease killer in the world today. 1.25 million TB deaths in 2023. Now this is down slightly from 1.32 million in 2022. Now, compared to COVID last year, that was 320,000 deaths. So you can see tuberculosis is, 4 times higher than what's happening with tuberculosis. So it's kind of depressing. We know where TB occurs. It's mostly in low and middle income countries, and 6 countries bear 87% of the or 56% of the TB burden is in India, Indonesia, China, the Philippines, and Pakistan. So that's about half of it altogether is in those countries. 12% are in children, 55% in men. Men tend to get more TB than women, 33% women. And the WHO director stated the fact that TB still kills and sickens so many people is an outrage because we have the tools to prevent, detect, and treat it. It's really quite remarkable. And what this means in these, particularly in the low and middle income countries, is that the cost to the society itself and to the people is really nothing short of catastrophic. So it has a huge impact on income.
Mm-hmm.
So,
Very huge effect.
it's really tough. We have a long way to go with TB.
Mm-hmm. A long way to go, and we will keep up to date on that as much as we can as these numbers come out. But another really big headline this week was regarding the RSV vaccine and its real world effectiveness, and also how much the use of these vaccines could save the public health sector and, you know, healthcare costs in the United States generally. So, can you break that down for us?
Yeah, so RSV predominantly has a serious consequence for young children, very young children, under a year of age for the most part. And there is a prevention treatment for that. And for older adults over 60, and for anyone with a severe immunodeficiency, especially somebody who's had an organ transplant. There it can cause a lot of trouble, and including death. So the studies that got the 2 vaccines approved for RSV found about an 80% efficacy rate in preventing hospitalization and death. And so this report that was published in the Lancet is the #1 worldwide medical journal, showed in a very large analysis that was done that overall 36,000 hospitalizations and 37,000 emergency room visits included in the analysis demonstrated that the vaccine was 80% effective in reducing the hospitalizations or the emergency room visits, and this includes death. So it was just like the studies. The number is almost exactly the same, but the studies that got the vaccines approved in the first place. So this is just very good real world data that shows that out there in the real world, it's having an effect. Now, how does that translate? Well, yes, a lot of people, 80% of people are going to have less illness or having to go to the emergency room or the hospital or whatever. That cost of RSV infection in the United States, the annual cost of hospitalization is estimated to be between 1.2 and $5 billion. That's enormous. Now, the uptake of the RSV vaccine, people have seen the commercials on television, whatever, has been relatively low. And people, the term RSV, it's, everyone knows COVID. I think everybody knows TB. Everybody knows the word pneumonia, but they don't know which type of pneumonia typically. And that since this one only affects young kids, the mothers get it. But here we're talking really about the older population. Now, the mothers can take the RSV vaccine while they're pregnant, and they can protect the baby. Doesn't hurt the mother at all. She gets protected against RSV too, although she's not very much at risk. But anyway, that's a lot of money. And, right now in the United States, what's happening is just an increase in the number of people who don't want to take any vaccines. And this has a cost, and the cost is in the billions of dollars, let alone the number of hospitalizations and deaths. So you have to put it all together in one place. So far, the vaccine has been very safe and well tolerated.
Mm-hmm. Now, we did talk about this next subject a few weeks ago, touched on it, but there have been some updates in the case numbers. We are having a very, very high whooping cough or pertussis year here in the US. Can you tell us about those new numbers?
Yeah, at this time last year, the number of whooping cough or pertussis cases was about 4,500. This year, it's up to almost 21,000. So this is this astronomical increase. And why is this happening? Again, it goes to the vaccine uptake. The people that don't give their kids the Pertussis vaccine are just leading to all these cases. People can get very sick from whooping cough, and you can even die from it. So it's something that really people need to really reconsider, because it just it's not going to go away, and it's only going to get worse.
And I understand that that vaccine, it's not a one and done. You do have to get it every so often.
Yeah, the immunity is not lifelong.
Well, very good to know. And another update on a story we have been following for months is the H5N1 avian flu. There's been a couple of more human cases, and our farm animals are also continuing to get infected. Can you bring us the latest data?
Yeah, it's not going away, but it's behaving a little bit different than we had anticipated. So far, there's 41 cases in humans. Nobody has died. I remember years ago from Asia, the mortality rate was up to 50%. So something's happening there. It's not as serious as it could have been. So that's good. But still, you got 41 cases. And other than that one case in Missouri, we don't know. It's not easy to transmit human to human. It's all coming from the animals. So if you look at dairy herds, there's 442 herds across 15 states have been impacted, cattle and pigs. And this is, and the poultry, I mean, millions of birds have been culled. So it's having an effect in agriculture. It's also worldwide. Turkey is reporting cases. UK reporting, everyone's reporting cases. All you have to do is look and you find it. So, but I think the good news is that still human-to-human transmission is very low, if at all, and that's good. But if these things mutate and things could change, but it has to be watched very closely.
Yeah. And as a reminder, there is an ongoing clinical study for a vaccine against the avian flu for cows. So people are looking into it. Hopefully we'll have some updates on that soon to bring to you.
There's a stockpile for humans too. So it's kind of like we're ready to go on that one.
Yes, very good to be ready to go there. And now some positive news that we can share regarding the Mpox cases out of the Democratic Republic of Congo and the outbreaks generally as the vaccine drive has started. Can you share with us, what that news is?
Yeah, well, we've been reporting on this and how long it took to get the vaccines there, to get this thing under control. It's very difficult to diagnose. You can look and make a clinical diagnosis, but that's pretty vague. 13 countries in Africa have reported cases, but it's mostly in Congo. But anyhow, the vaccines finally got there and they got out into the field, and already they're seeing a response. So it's the number of cases. Congo is where most of the cases are. They're reporting 200 to 300 confirmed cases every week. This is down from 400. So that's good. So it's a good sign. It public health impact efforts, and the vaccine is working. So far this year, roughly 43,000 suspected cases in Africa, but 1,000 deaths have occurred from Mpox, mostly in Congo. So we'll just keep plugging away at that, and hopefully get that under good control. The UK also reported 2 additional cases of the clade 1B, which is the nastier of the 2.
We will continue to keep our eyes on the Mpox outbreaks and continuing to hope that those public health efforts do indeed continue to work as intended. So that is some good news, but some less good news from back here in the United States is that we have seen really high dengue cases here this year. Can you break down dengue for us and tell us about those numbers?
This was a big dengue year in the whole Americas and has been particularly devastating in Brazil. The United States has doubled the number of cases reported this year, up to 6,800 cases compared to 3,300 last year. 4,400 of those were locally acquired. They just got it from being here in the United States. And 2,300 were people that traveled to big dengue areas, the Caribbean and the rest of the Americas. Most of these cases are in Puerto Rico, which is, obviously the Caribbean basin, and that's a big risk area. But, LA County has reported 11 cases this year already. So dengue can just pop up. It doesn't have, the thing to remember about dengue is you can have dengue even if you didn't travel, although it's less likely, unless you travel to Puerto Rico.
Yeah, mosquitoes have had a very, very big year this year. Remember to wear your bug spray, people.
Yep.
And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this morning, breaking down the research and informing us on the latest infectious disease news. Thank you very much.
Well, thank you.
And thank you all for joining us for another episode of the Ask Dr. Murphy series. We hope to see you again next week. And as always, if you have any questions or suggested topics, please feel free to comment them down below or contact us through any of our social media in the description. Have a great weekend.